in.
Hello, I'm Alexa. I'm going to be your nurse today. Could you give me your name and date of birth, please?
Mikhail Arthur, 12/17/57.
Okay, perfect. So I'm just here to talk to you about your new medicine, Prednisone. Are you open to hearing about it? Okay, perfect. I was just reading your chart over and I saw that is it a little hard for you to take your medicines?
Yeah.
Hard to easy to forget to take them?
Mm-hmm.
Okay. Well, I just wanted to, talk to you about that because that is really important. We want to decrease that swelling and the pain in your hands and, help you be a little less pain-free and complete your activities of daily living a little bit easier. So some goals I have for our teaching session today, going to be, hopefully you learn why you're taking this medicine, some side effects of it, and some risks if you don't take it, by the end of this teaching session.
Okay.
So I thought a good idea for you would be this pill organizer. It's just a 28-day organizer with alarms built in to help you, remember to take it. So you could get someone to come over, help you open those vials originally, fill them all up, and then it will alarm you when to take them. If you need help, please give us a call. So Prednisone, that is the generic name of the medicine, but you could also hear it as Rayos or Deltazone, same thing. It works by suppressing the immune system and the inflammation response to help you with the pain from your arthritis in your hands. It does come with a lot of side effects though because it is a steroid. Excuse me. Swelling of the face, hands, and feet is common. Insomnia, mood swings, increased appetite, but there is ways to manage that. So taking it in the morning with your food could help. Belly upset is another one of them that could help combat that. Taking a sleep aid, or if it becomes too bad, or stuff like that. There are some drug and food interactions with this medicine, so aloe, licorice, buckthorn, and senna, the laxative, so just try to avoid that. We're going to be taking it in the morning, like I said, with your breakfast. We wanted to stay in your system to help you, help the pain go away a little bit. And right here I have the prescribed doses for you, so it's going to be 80 milligrams for 5 days, 60 milligrams for 4 days, 40 milligrams for 4 days, 20 milligrams for 4 days, and then 10 milligrams on and on until the prescriber says otherwise. So some handling instructions with this medicine: we're going to keep it in a cool, dry place. Room temperature is okay, but not in the bathroom, away from children, and not when you have an active infection. So if you're not sure if you do, or you just want us to check you out, please give us a call. Do you have any questions at all? No. Okay. Could you tell me why you're taking Prednisone?
To decrease the inflammation in my hands.
Yeah, right. What are some side effects?
Insomnia, GI upset, and mood swings.
Yep. Do you know what could happen if you don't take it?
The symptoms will come back, so pain and inflammation might return, swelling.
Right. Okay. Well, moving on, I also wanted to teach you how to inject your heparin that you're going to be going home on. So could you just give me your name and date of birth one more time?
Mikhail Arthur, 12/17/57.
Perfect. Okay. So the first thing you're going to want to do is hand sanitize your hands and then apply gloves. And just a little bit about this. Are you willing to learn about it? Hear about it?
Sure.
Get some help? Okay, perfect. So the generic name is Heparin. You might also hear it be called Hep Block, which is the brand name, but still the same thing. So we're going to be you have it prescribed 5,000 milliliters, 5,000 units per 1 milliliter, 3 times a day. So we're going to be actually injecting it into your abdomen, not today, but when you go home. So you can do either side of your belly button, about 2 inches away, or the back of your arms. And we're going to alternate sites every time we do it, okay? Because we don't want to get irritation. So if you start on the right, the next time you inject, it's going to be on the left. The equipment you're going to need to do this is going to be your heparin bottle, your syringe and needle, which would be a 3 milliliter syringe and a 25 gauge needle with a 5/8 thickness. Some alcohol swabs, if you don't have any, we can provide for you. And then this is just a fat pad that we're going to be using today instead of actually injecting on you. And of course our sharps container, which we'll be sending you home with. So I'm just going to demonstrate. If you want to follow along with me to save some time, that would be great. So the first thing you're going to do is you're going to identify your site on your body, right? So that's going to be 2 inches away from your belly button. And then you're going to open up this alcohol pad and we're going to rub your skin in a circular motion to clean it with this alcohol pad. Perfect. And then yours are already going to come attached just like this with your needle and your syringe. So if you want to pull that out, we're never touching the top of this with our hand. Don't want to stab ourselves, keeping it sterile. So you can also take your other alcohol swab, and we're going to clean the top of this before I forget. The top of your bottle. You can put it down and then pick your syringe up again, and we're going to just stab it right on the top. And then you're going to pick it up and you're going to draw back 1 milliliter. So the top line, okay, not the bottom black line, but the top one. There you go. And then tap it on the table for any air bubbles. Get that out. Perfect. And then we are going to take it out straight up without touching anything. Perfect. And then we'll already have this cleaned. So you want to hold it like a dart, pushing with your first index finger, not your thumb. We're going to pinch the skin up like this, and then we're going to inject at a 45-degree angle. So just about like this. We're going to go straight in. Very good. And then we're going to push with our index finger all the way down, and then we're going to pull out exactly how we inserted. Perfect. And then applying the cap without touching it, you're just going to scoop it up just like this. Perfect. And then this always, always, always goes in the sharps container, never the regular trash. Perfect. Do you have any questions?
Nope.
Okay, very good. Nice to meet you.
You too, thank you.